to give Rick as much time as possible. So thank you all for coming today. We'll let others continue to flow in, but it is my pleasure as the Grand Rounds chairs to welcome you all to the Grand Rounds today. This is part of our larger series. This is our second to last for this academic year. In April, we'll be welcoming Michelle Mello to join us as a speaker. But it's my pleasure to introduce a colleague and a close friend of mine, Dr. Rick Weinmeyer. As you can see, he's quite accomplished with his multiple degrees. I would like to try to tell you that I remember where he got all of them and the order that they came from. But he's an assistant professor at the Beasley Institute for Health Policy and Law at Loyola University. He's also a leading expert, and frankly the only expert I know, at the intersection of law, policy, and sanitation. And we are so grateful to have him here. He received his JD at University of Minnesota and his PhD from Northwestern, his MPhil somewhere in Europe, and his MA at University of Minnesota as well, I believe. So thank you, Rick, so much for coming. We're really excited to hear about your work and identify potential avenues of collaboration with our faculty.
All right, I didn't fall down the stairs, so that's exciting. Is that better? A little better? Okay, I just wanted to. Thank you so much for having me, Jelaine. It's great to be here. I really appreciated the invitation. It means a lot. And Jelaine, you were close. I got my master's degree at Cambridge, which is no longer part of Europe. So close. Okay. So thank you again. This is, again, just like a really big honor, and I really appreciate everyone's hospitality. Everyone's been so nice today. So thank you again. So as you're aware, this is a hot mic. As you're aware, my talk today is about the struggle for basic sanitation and hygiene in our modern nation. Now, you may be, okay. All right, I'm gonna move gently up here. You may be shocked by this, but even though I kind of give off this impression of a vaguely European sophisticate, I spend a lot of my time thinking about toilets. But before we get started, I just kind of want to ask, how many of you have ever faced a challenge in accessing or locating a bathroom before when you're out in public? Very good. You are not alone here, but I thought it would also be funny if I just gave a disgusted look and like, oh my God, like what's going on in your life? But no, you are in good company. We are all in community here. Okay. So the other day, this headline appeared in my Google alerts, and I basically grabbed my computer monitor and screamed, for the love of God, yes. Yes, yes, yes. And this is what my work is really kind of about. The state of our public toilet system, and I'm using quotes when I say public toilet system, it's just not good, okay? And it tells us a lot about the state of our society and our nation at this very time, right? I firmly believe that toilets, and more broadly sanitation, are not just about where we go, when we need to go, but they're really core to how we think about humanity and how we think about the humanity of others, what rights people have, and of course, what we think about public health. So, as we embark on this beautiful journey together, here's a little roadmap. So first, how did we get here? Why do we have so few public toilets here in the United States? And why aren't there other options? Second, I'm going to talk about what toilets have and continue to have in common and say about civil rights. Again, really tying into this historical narrative about public toilets and our determination of who is worthy to access these resources. Third, I'm going to give you just some straight up public health facts about what happens when you don't have access to a toilet and what happens to population when we don't have access to a toilet. I also include legal harms in here that attach to the lack of toilets or when someone's denied a toilet. And fourth, I'm going to argue that our toilet current dilemma is really a government failure. It's also a failure of law in many respects. Toilets are public goods. And often we look to the government for the provision of public goods. But when government and law at this time, what they have provided us is completely insufficient. And finally, I'm going to discuss some future proposals, some things I'm thinking about and that I'm really putting out into the world, because if I can't engage in blatant self-promotion, why am I even here? Right? So let's start our journey with a little bit of history. And we'll start in the late 19th century. This was a time of immense economic, social, and political change in the United States. The US was really experiencing this huge tidal wave of immigration that flooded into American cities, with particularly impoverished people who were fleeing crises from abroad. And our American cities were not prepared for this influx. We also had the structural shift that was going on in society, where people were moving from a largely agrarian way of life to a much more urban way of life, one centered on factories, workhouses, and industrialization. It was this time of incredible innovation, struggle, and violence. And it was also disgusting, okay? It was gross. Streets of American cities were filled with waste. Men and women were quite comfortable relieving themselves in public, and with so many new arrivals who are arriving to this unprepared urban landscape, residents were just crammed into deplorable tenement housings such as this, and they had access really only to privies or outhouses in these urban environments. And privies were little more than just these covered over pits of waste. And they were blamed for outbreaks of all sorts of things, kind of going along with this miasmatic theory that existed at this time. So they were blamed for cholera, yellow fever, dysentery, diphtheria, and all other sorts of contagions. Wealthier Americans, by and large, had the luxury of indoor plumbing, but not everyone. But the poorest had nothing. And they disposed of their waste in alleyways, in the streets, and it just kind of formed this toxic swill that really came to define American urban living at this time. So the call for public toilets really began, as so many other innovations in public health at this time, with good old puritanical moral values, right? This push for social cleanliness and godliness, okay? Wealthy urban activists were just horrified by the conditions that they were seeing, the poverty, the lack of sanitation, and so they began to advocate for the installation of public toilets, better known as comfort stations. And this is a comfort station from Indianapolis from, I believe, the 1930s. So alongside the development of these comfort stations and public toilets, we had pay toilets, which were also coming into fashion. You would pay a small fee to arguably get a cleaner, more dignified experience. But of course, urinals were free, okay? So just think about that, put a pin in that. At the same time, businesses such as department stores, transportation hubs, other public accommodations often made available their luxurious toilets to some members of the public. Obviously, there was segregation going on. I'll let you think about who might have been left out. It'll be a surprise. As the cost of maintaining public toilets really began to rise, local governments began to just invest less and less in the public toilet facilities that they had available at this time. A lot of it was driven by the concerns about vandalism, disrepair, maintenance, whether or not toilets were the sites of actual or rumored illicit behavior. And so throughout the 1960s and really up through the 1980s, governments closed their toilets. So that really only left in place the private toilets that existed in public accommodations. And so what happens with that? because now we are relying primarily on just like this private provision of toilets. From the beginning, discrimination starts to just really grow out of this disparity that exists there, and particularly discrimination towards vulnerable and disfavored groups. So, of course, we have Jim Crow, which was not only about barring Black Americans from public accommodations, but as the state was also barring Blacks from accessing sanitary relief, if not just through segregation, but simply just not providing toilets at all. There's a field out there. Good luck. With the enactment of the Civil Rights Act of 1964, of course, we see many of those discriminatory acts fall by the wayside when it comes to public accommodations. But I want to point out that when we think about civil rights law and public accommodations law, we're not only talking about protected classes, so like race, sex, national origin, or depending on the jurisdiction, maybe sexual orientation or gender identity. I want to remind you that public accommodations are about property. They are about access to and perhaps exclusion from both public and private property, right? More on that in a moment. Obviously, racial discrimination, of course, continues to be just sadly all too common and prevalent when it comes to toilets, lest we forget the incident in April 2018 in which 2 Black men were arrested at a Starbucks in Philadelphia after one of the men asked to use the bathroom despite not having made a purchase. Starbucks, of course, if you maybe you remember this, they took an afternoon. They closed everything for an afternoon, and then they figured out discrimination, okay? Starbucks created an open door policy based on the reaction and the public reaction based on these arrests. And they opened all their toilets to anyone paying or non-paying. There were some problems with that, and in January 2025, they closed the door shut on all of their bathrooms unless you are a paying customer. And it's according to their code, their coffee house code of conduct. Don't be too shocked. Women and girls have also been excluded from considerations of public toilets, particularly public toilet design. And this has occurred as long as public toilets have existed. One of my favorite toilet scholars, there are such things, quipped, if you want to know the true position of women in society, look at the queue to the toilet. Okay? Over the last 30 years, we have seen dozens of states and cities adopt what we call potty parity legislation, which these are bills that amend building and plumbing codes to ensure that more toilets are provided to women than men in places of public accommodation. Usually it's a 2-to-1 ratio. Women were also instrumental in passing bans on pay toilets that started to, of course, grow up alongside public toilets. And this was driven again by the fact that, of course, men could use pay toilets for free, while women always had to pay. This is a very historic, wonderful photo of March Fong, who was an assemblywoman from Oakland, who really kind of was a strong opponent of pay toilets and really led the charge to their more widespread prohibition across the United States. And because we are a nation of innovators, we're so creative, right? We have found new ways to discriminate, okay? As of today, 21 states have enacted some form of anti-transgender bathroom bills. These bills vary in scope in terms of the places where they bar trans women and men from using the toilet that align with their gender identity. And in 3 states, criminal penalties can attach, okay? Very severe consequences. I always try to remind people when people are talking about these bills, but what they do is that they deny you from going to the bathroom, okay? That is an especially cruel act and a very harmful act in terms of dignity and self-worth. Kansas is the latest state to adopt a bathroom bill, and it was enacted using a supermajority vote to override the governor's veto. So what happens? What happens when you cannot find access to a toilet? 2 scientific words. Nothing good. Okay? Nothing good can happen. Keep in mind that the average person will have to use the restroom or find a restroom about 6 to 8 times a day, right? Many of us don't even think about it, really, right? We just go, right? But we start to think about it when we can't find a bathroom. Tens of millions of Americans really don't have that luxury. Millions of Americans live with episodes of urinary or fecal incontinence, whether it's the result of aging or disability or another type of health condition or perhaps the medications they're taking. Talk to a pregnant woman about her need to use the bathroom. Furthermore, numerous illnesses present with symptoms of more frequent urination, so like diabetes, prostate cancer, urinary tract infections. While there's also flares that can occur when someone has inflammatory bowel disease like Crohn's or ulcerative colitis, and you need emergency access to a toilet. Urine retention, please do not hold it, okay? This can prevent the elimination of bacteria, it can stretch the bladder, it can impair functioning, it can even lead to kidney damage, okay? No joke. Delayed defecation, of course, can result in abdominal pain, constipation, hemorrhoids, and diverticulitis. And if you have any type of acute or chronic conditions, like some of the ones I've just described, you need to be near a toilet, okay? That can greatly reduce your ability to move through the world. You can't leave your home. You can't spend time away from home. Forget about things like, I don't know, going out to protest. You might not be able to go and stand in line to wait to vote at a polling place. And you almost certainly cannot go out and enjoy the broader social goods that exist in the world that others can. So some of the greatest public health challenges that have existed because of a lack of public toilets in the United States have been borne by the homeless community. For example, in 2025, the Oregon Health Authority reported an increase in cases of dysentery in the unsheltered homeless population living in Portland. There have been other outbreaks of shigellosis bacteria, which of course cause dysentery. And this has been reported again in more homeless communities that lack reliable access to toilets. Equally troubling, between 2016 to 2024, there was a massive outbreak of hepatitis A across the country, okay? The outbreak reached its peak in about 2019, but in the end, it resulted in almost 45,000 reported cases. There are about 28,000 hospitalizations and 424 deaths in 37 states. Okay, that is big. The outbreak was predominantly felt amongst persons experiencing homelessness, who are living in crowded conditions that lacked toilets. So not only was this tragic, right? Maybe you're like, okay, well, what does a life cost, right? But if you want to look at the die-hard numbers, between 2016 and 2020, one estimate put the cost at about $306 million just to hospitalize individuals who experienced this outbreak. Arguably one of the most severe consequences that can happen, of course other than death, is criminalization of public urination and defecation. So legal prohibitions for public urination and defecation are found throughout the United States at multiple levels of government, so both at the state level, the county level, and so forth. Violations can lead to civil and criminal penalties and reach fines of upwards of $2,000. And while repeat offenders can face escalating fines, placement on a sex offender registry, even incarceration for days or months at a time, what is particularly pernicious about these laws is that they are typically enforced against those who have no option or have very few options. Okay? This includes homeless people, people living in low-income communities. Homeless advocates argue that such facially neutral laws, we would say it's facially neutral because it doesn't target a particular population, but these are meant to actually just exile the visibly poor from our society, right? In an attempt to construct this false sense of civil order, right? I don't see any poverty. Clearly, we have no poverty. Outside of homelessness, in recent years, children have been criminally sanctioned for urinating in public. And recently, as of recently in 2017, Tucker Carlson used claims of public defecation by immigrants and immigrant children to fuel anti-immigration rhetoric and facilitate political and legal attacks against against immigrant communities, particularly in Pennsylvania. So, how has the government and the law met the moment to address this crisis? They really haven't. So let's begin to count the ways. Right? Let's take my beautiful city of Chicago for an example. So in 2017, an alderman proposed an ordinance to ban customer-only policies so that people could use toilets in public accommodations, right? If you need to go, you should be able to go. The mayor at that time, Rahm Emanuel, shut it down. Shut down this policy, made sure it did not pass. He should definitely be president. 4 years later, the Chicago Tribune put out a deep investigation into the city's public toilet supply, finding that swaths of the city contain, quote, few or none, including many of Chicago's densest and most popular commercial destinations. In response to this, 19 alderspeople responded by putting forth a resolution calling for more public toilets and to launch a public toilet proposal and pilot project. Nothing came of this resolution. In 2024, so 3 years later, the primary sponsor of the 2020 resolution announced that the city was going to engage in a public toilet pilot program, and they were going to install 4 high-quality toilets. No agreement was ever put into place. Last year, the same alderman announced that a public toilet was going to be installed in his ward. Thus, after nearly a decade of proposals and politics, the city will hopefully have a single toilet. Go Chicago. Now, I can't beat up on Chicago too bad because this happens everywhere. Part of the problem is that standalone toilets are very expensive. They also can be difficult to install given sewer access, water lines, permitting, and the like. And the bureaucratic hurdles that really need to be overcome are quite onerous. So, for example, a few years ago, word got out that San Francisco had approved the installation of a single toilet at the price tag of about $1.7 million. Okay? 1 toilet, 1 sink. Right? This was incredible pushback against the installation of this toilet. And even Gavin Newsom at one point canceled the entire project. Another great guy who should definitely be president. But what it revealed was really the maze-like legal requirements that a simple project like this can entail. And installing a public toilet is actually quite difficult if you have to go through all the approved government processes. Never lose track of this. So we've talked about, about the government and the bureaucracy and the policy hurdles that exist there, but never lose track that we live in a negative constitutional framework. Okay? Our federal constitution is designed to keep an overbearing and powerful federal government at bay. Okay? And this has also meant a very thin provision of what we would call positive rights, affirmative obligations on the part of the government. So in 2020, a case in the Eastern District of California, 2 homeless plaintiffs filed suit against the city of Sacramento and the Sacramento Police Department for the installation, but then removal of a portable toilet near their encampment. They sued, wanting to have the toilet reinstalled, and they raised a claim that there was a substantive due process rights of privacy and bodily integrity that include the right to eliminate body waste in private. However, they could not point to a source of authority that interpreted the 14th Amendment in that way. That's a problem. Although the plaintiffs lost, the court did note that Justice Thurgood Marshall wrote in a dissent that there are few activities that appear to be more at the heart of liberty guaranteed by the Due Process Clause of the 14th Amendment than the right to eliminate harmful waste from one's body away from the observation of others. Unfortunately, of course, this was in a dissent, and therefore it had no precedential binding effect whatsoever. We can skip over that. Arguably the most important case that kind of gets to this issue of a lack of public toilets and the nation's homelessness crisis and just the many public health challenges that have really flowed, unfortunately, from this population and the legal harms they experience, came in 2024 in a case called City of Grants Pass, Oregon v. Johnson. And in this case, the US Supreme Court, by a vote of 6-3, struck down a ruling by the Ninth Circuit that said that states cannot impose criminal penalties on sleeping in public if you have no other option, because it's punishing status, okay? One status of being homeless. That is prohibited by the Constitution. In the view of the dissent, they really framed this in this necessity argument in that if people don't sleep, they die, okay? Similarly, if you can't urinate or defecate because you don't have access to a toilet, you will die. What we're doing here is punishing those who have no other options, okay? And they cannot afford options like so many people can. But the majority saw a different side of this argument, one that embodies this affirmative defense of necessity that is found in tort law, in property law, and in criminal law. If someone is in an immediate danger and they have no available options to them, they may be able to break the law in order to, address the need that they are experiencing. If people are facing life or death situation, they can raise this defense at some point in their legal process. But in reality, necessity is a very narrow defense, okay? It's a very limited get-out-of-jail-free card. So, what can we do to better address our lack of public toilets? So, some of the simplest approaches that are being done are happening in some jurisdictions around the country right now. So for an example, in cities such as Seattle and Minneapolis, the governments have undertaken surveys to figure out just how many public toilets they have, what conditions they're in, where they're located, and I kid you not, cities have no idea where their toilets are located. They're usually governed by a variety of different agencies. There's overlapping levels of authority. They just can't figure it out. So they're undertaking surveys to get to the bottom of this mystery. Similarly, some jurisdictions have looked at neighborhoods where they have a high record of complaints or citations related to public urination and defecation. And so they try to provide mobile toilet units or other temporary solutions to those locations. Big shock if you provide portable toilets or mobile sanitation units to people, rates of public urination and defecation go down. Okay? And more cities are looking actually to prefabricated toilets and placing them throughout their jurisdictions to see how these toilets are used by their populations, and doing what they can to make sure that those venues remain clean and accessible. Probably the most successful one at this point is in Philadelphia with the cute term, the Philadelphia flush. One important consideration to understand is that the toilet laws that we do have in place, and there aren't very many, we need to find ways that we can strengthen the rights and obligations that they provide. So for example, in 20 states and Washington, D.C., we have what are called restroom access acts. Okay? Sometimes they're known as Alley's Law. And these are laws that require people with qualifying medical conditions, such as ulcerative colitis or inflammatory bowel disease. It allows them emergency access to the employee restrooms of a business that may not provide public restrooms at all. However, these laws depend on whether there's a public toilet in the vicinity, what kind of business it is, how many employees are working at that time, and so forth. The problem that I'm kind of working on and trying to unearth here is that how many people know about these laws? It's extremely slim. Very, very few people know anything about these, particularly people who these laws were designed to help, so persons living with inflammatory bowel disorders. Businesses, of course, know nothing about these laws, and so they are unaware of the legal obligations they have. There are also extremely weak enforcement mechanisms when it comes to these laws. You might get a letter from the county attorney for violating it. You might be asked to pay $100 and so forth. But for these laws to actually work, I believe that they require higher financial penalties and perhaps private rights of action that will allow those who are denied access to a bathroom to be able to sue to either prohibit that establishment from doing so forth, or to perhaps collect civil damages if they're injured. My latest project that I'm working on, and here comes just like the really obnoxious self-promotion, is this article I have forthcoming, probably from some extremely prestigious law journal. It's called Making Toilets Public, which is about looking at toilets through the lens of property law and what we can do to change our property system in order to provide more public toilets. So again, because toilets are largely kind of kept locked away from the public in restaurants, coffee shops, and stores and so forth, they've become private goods. They become these privatized goods that only a few people can access. But in order for them to be public goods, we need property law to move in a direction that recognizes that property owners have obligations not only to themselves, but to others, to their community as well. In law, we give considerable deference to property owners and private property rights, particularly the right to exclude. And this is the power to say, get off of my property, or you cannot use my restroom. But there's a school of thought called progressive property that really argues that the right to exclude, of course, is by no means absolute, and that it needs to be balanced against policy issues for goals of empowering people to live good lives, right? Society does better when people are living good lives. And I argue that includes a right to public health and improving the public health. So what is coming out of my harebrained ideas here, right? Well, one thing we could do is we could amend public accommodation laws to explicitly include toilets that are found in businesses. Public accommodation laws are largely silent when it comes to toilets, and courts have held that if a business does not provide toilets to the public at all, doesn't provide toilets to anyone, they don't have to provide toilets. But building and plumbing codes actually say otherwise. And in fact, they state that businesses shall provide toilets to the public. So I believe that we should amend public accommodation laws to better harmonize these regulations. I also argue that municipal ordinances should be where this should be happening, because cities have long served as innovators of public health. Smoking bans, trans fat bans, and so forth. But also because city governments are just more adept at addressing these types of reforms. Public accommodation laws are also probably a suitable way for level of intervention because they have developed systems for filing complaints, conducting government investigations. They also provide private rights of action to individuals so that they can file suit, again, to seek an injunction or to collect civil damages from a violating business. Finally, again, using progressive property theory, I'm also looking to this excellent idea that's been developed by a property and poverty scholar, Ezra Rosser, at American University School of Law. And he argues that we should take the decision from Grant's Pass extremely seriously. If justices think that this necessity defense is this robust, powerful defense, we should take it that way. So therefore, in instances where, say, someone is homeless and they do not have access to a toilet, they should make it clear that this is an immediate emergency and they have no other alternatives, and then raise the necessity defense in the event that they might trespass into a business to use its toilets. The more people who know about this defense and the more people who invoke it, more property owners will come to realize that their right to exclude is not without limits, and this may encourage them to then push for policy measures for the government to begin to address what is going on, right? Provide more public toilets, improve the public health, and so forth. And really what this gets down to is this concept that human life is more important than private property, okay? I know, it's a crazy idea. And that we should start to really shift our policy priorities to do just that. And I think that we can start to do that with toilets. With that, thank you so much. Appreciate it. I'm also open to people sharing their toilet stories. I get them all the time, all the time.
Hi. I appreciate you naming sort of the physical toll that's taken on trans people who are experiencing bathroom bans. Mm-hmm. And I guess I kind of keep thinking about that, like how do we counter what's happening? And I'm just curious about, do you envision a future where there is no sort of gender segregation or public toilets stop being gender divided at all, and we sort of imagine instead bathrooms that are available to everybody at all times?
Yeah, I think that's actually a very powerful argument that several people have actually made, particularly some feminist scholars have made as of recently. One argument I've heard is just segregated bathrooms, they're just not worth it. We need to give up this fight, right? And so others have argued that under the due process clause that this is essentially unconstitutional, we shouldn't necessarily be segregating along these lines. I also think one thing that's going to help and maybe change the effect of this is something that Kristen Underhill at Cornell Law School has pointed out, is that this is going to have spillover effects. And we're actually starting to see that when it comes to trans laws, that we are policing gender in all sorts of ways, right? So if you are perhaps, I don't know how to put this, but a more masculine woman or a more masculine presenting woman, they are now being followed in private businesses and they are being harassed. And because of this type of harassment, that there might be more pushback to these laws, potentially, we'll see. But I think a lot of people have now argued that sex segregated bathrooms, it's just not worth it anymore.
I'm going to ask you the question that I hate when people ask me, but I'm going to ask you anyways. How does this compare in the US to other countries and how they manage the similar issue?
Well, I hate that question. So some jurisdictions or some places have done an okay job with things. So there's the London. So there's the London London has what's called the Community Toilet Scheme, which actually started in the borough of Richmond, where they provide financial incentives to businesses to open up their their bathrooms, and that seems to have worked pretty well to a certain degree. Right, businesses appreciate being compensated to deal with maintenance or cleaning and so forth. They're in Edmonton and Montreal have also introduced these types of measures. But there's always a lot of initial pushback from the business community, and we're seeing that here in the United States. So Minneapolis has talked about providing financial incentives to open up their bathrooms. And again, they're getting pushback from business owners, which you can understand, right? You're a coffee shop, you're, a clothing store, you just don't want to provide bathrooms. That's not what you're in this for. So that's where there's been some change. People argue that Europe does a better job of providing public toilets. I just don't necessarily think that's true. They provide a lot more paid toilets. So if you're in Europe, if you pay €1, you can access a clean toilet out in a park and so forth. But they also face a lot of challenges with this. Some places are, trying other types of approaches, but no one, I mean, everyone points to Japan, but that is completely, like, we're talking about a totally different culture, totally different government support built around cleanliness and sanitation and hygiene that I don't necessarily think translates well to the United States. So.
Thank you for your talk. Can we think about intense events like the World Cup?
Yeah.
Coming to Atlanta soon, and how we're maybe, I don't really know at the city level, going to be prepared to provide lots of toilets to the people that come to town, and is that at all a model we can think about?
Sure. So, I mean, I don't know anything about soccer, but I'm going to anticipate that they're going to be providing a lot of portable toilets, right? And so human rights law has generally, or human rights law kind of in and around sanitation issues really kind of pushes back against portable, temporary solutions. People, universal truth, people hate portable toilets. They absolutely hate it. In places like South Africa, where slums have been provided with temporary toilets, there've been riots. Okay, and people, you see that too in, like, with homeless communities in the United States. They also push back on being provided portable toilets. So I think that's probably what we're going to be doing, and that's what I've seen at other types of, big, massive events. But it's just not a long-term solution.
You were talking earlier in the presentation about immigration, and I'm sort of curious, of your thoughts related to immigrant detention centers. And the restroom situation that we're hearing, horror stories about. There's plans for one of these detention centers in, I believe, Social Circle, which is a very small town and doesn't have the infrastructure to tie into the sanitation system, and there's really no plan for it.
Yeah.
So it's sort of it seems like a purposeful way to ensure lack of dignity in a situation where there already isn't any. So I'm just kind of curious what you've heard in relation to detention centers.
I haven't heard anything. I haven't heard anything specific. I mean, I've obviously heard that there's lots of, like, sanitation concerns, that these places are just, like, not built for that, and just, like, degrading conditions. But I also think that's the point that they're trying to make with this. We're not going to treat you like a human being while you're here. So I don't think that they're going to provide. I'm hypothesizing. I have no insight into this, but I would assume that they have no plan to actually provide, like, good sanitation to, like, these facilities. So.
Oh. Maybe follow up with
Sure.
Well, so waiting for another question, but just to think about the role of the city and
Yeah.
the overlapping federal jurisdiction, and, like, the city, it's the city's sewer system, but the federal government's facility.
Yeah, I mean, again, like, sewer systems are really antiquated. I know many cities, like, it's kind of an afterthought, right? We have these really outdated systems, and I haven't heard anything about the federal government. I mean, yes, there were, arguments about, building. There was some money that was made available for infrastructure development and things like that, to bring things back, up to, like, I don't know, maybe 20th century standards. But I'm not aware of anything that's happening right now on those fronts. Oh, sure. And we can also end. It's okay.
As you've been talking, I've been thinking about accessibility of restrooms. So
Yeah.
not only, is there, sorry, I should rephrase that. Not is there a bathroom accessible, but could someone with a disability use that bathroom?
Yeah.
And just curious your thoughts on that, because I've encountered that as caregiving for my dad. Not, maybe there is a restroom, but it's not one we could actually take him to.
Yeah, so I don't know the specific details of the requirements under the ADA, but if under the ADA, if you are providing a restroom to your customers, you have to provide one that is going to be ADA compliant as well. And there's also standards for new buildings and for rehabbing buildings. I will say that, there are slight signs of hope in some of this. So like and a lot of it usually does come down to like disability accommodation. So one kind of shining example is that there's been a movement to provide adult changing tables in toilets. Particularly, you see this in airports and in other types of venues. And cities and municipalities have been pretty accommodating to that and passing that through. So there are signs of light here and there. And there seems to be an effort, particularly when we're talking about restroom access acts, there is, again, kind of a push to make these laws much more conspicuous and to get people to comply and understand what the requirements are. So, but I mean, ADA violations, yeah. I mean, people spend their entire life looking at ADA violations and how businesses are non-compliant and how there is like very little enforcement. So,
thank you for your presentation. I was gonna maybe share like one toilet story.
bring it on.
Yeah. So I have a 6-year-old.
Okay.
So one day the school bus driver, had to, I think it was in the morning, had left for work, and my wife was going to put my son on the bus. So the school bus driver got there and quickly ran down and told my wife, I have to go.
Yeah.
So she had to go. I mean, she really needed to go. So when my wife told me, I'm like, oh yes, I can relate, because I mean, my job, I have to go to like patients' home, work for the health department, and I'm like, oh, I can relate because I know exactly how that feels.
Yeah.
And just kind of laugh over it, but this is like real.
Yeah. So I mean, I didn't cover all the toilet laws that exist out there. I mean, we'd be here all day. So there have been certain pushes, particularly in kind of the area of workers' rights. So Washington State in 2023, I believe, enacted a law that requires that truck drivers be able to use the restrooms of the businesses that they are shipping to or delivering from. In 2021, in New York City, delivery drivers who work for like Grubhub and these other types of apps fought for an amendment to the administrative code in New York City that has amended the code that now says that in these apps contracts that they engage in with various businesses, part of the contracts have to include a provision that allow delivery drivers to use the bathrooms of the businesses they're going to back and forth. So there's kind of some push in that. There's also for I think the last 3 or 4 years, there has been a law that's been introduced in Congress to provide, again, truck drivers access to bathrooms. And it's actually bipartisan legislation. It just never gets anywhere. So.
Hi, thank you for your presentation.
Oh, thanks.
If we do get to a time where there are non-segregated restrooms and anybody can use any restroom, how do you envision this working for people who are registered sex offenders?
I mean, that's a good question. I haven't necessarily thought about that. I also think that the freedoms of registered sex offenders are also so greatly restricted in so many ways that whether or not they'd be able to be out, in these types of spaces is in itself questionable. But I don't know. That's a very good question. That's something to think about.
Been out of the country a few times.
Mm-hmm.
So I seen, like you said, when you go to Europe, you have to pay €1, which is a cool concept. But if you don't have €1, you can't use the bathroom.
Yeah.
And then I also been to bathrooms that was not segregated. And the first time we going, yes, it was weird for me to just walk into the bathroom and use the bathroom next to a woman, and us wash our hands together. But I feel like it's a cultural thing. Like at first it's a little weird, but it's just what we accept in society. Those bathrooms are more so set up to where you have your own station, and you go in there from head to toe, you can't see the next stall. And when you're using the bathroom, someone can't get into the stall with you because it's a full door to the ceiling situation. You can't see under, and it's really just when you wash your hands. And I feel in societies that have those bathrooms, they're more conscious and nicer people to each other. So I feel like what she was saying about the sex offender thing, I think it's more like what do we accept into society? Because a sex offender can do anything to you. It don't have to be in a bathroom.
I think in terms of like gender segregation and the concern, these types of concerns that we have about breaking down these barriers and more like all-inclusive bathrooms, I think there's just like so much fear-mongering that goes into instilling and maintaining these types of segregation. I often think of like, again, kind of toilets and law all together, but like when you provide people with a new type of right and then you try to take that right back, it becomes extremely difficult. Like look at the Affordable Care Act. More and more people are becoming comfortable with the idea of genderless bathrooms and understanding that there's all sorts of diversity out there. If you have a little kid, maybe you're a dad with a little girl or a mom with a little boy, right? You need some sort of access to a bathroom. Or again, if you're taking care of a disabled family member who's of a different sex, right? The more you provide these types of opportunities to people and these types of resources, the more used to them they become, and the less they're worried about these kind of artificial distinctions that we've really created out of just like these weird historical moments that have just kind of perpetuated and concretized, over the centuries. So that's one thing to think about.
So I'm really curious about this legal doctrine of necessity that I've never even heard of until until you mentioned it. What are the?
It's also most people aren't really supposed to hear about it, right? Right.
I'm just curious what the limitations of it are. Like I'm sure we've all probably been in a public restroom where you walk in and you're like nope and turn around and walk back out. Is that a necessity? Who is that? Because of that necessity, does somebody have an obligation to keep it clean enough for people to use?
That would be part of the argument is that those types of circumstances or those types of situations are all the more policy justification for why we should, have people who clean bathrooms and attend to them and make sure that they are functional and operational, right? These could be jobs that people could have to make these places much more accommodating, and therefore people won't have to invoke a necessity defense where they face a situation like that. I'll just note that necessity generally happens where there's essentially almost like life or death or severe harm is going to come to you. So if you have alternatives that are available to you, you can't raise the defense.
I know this is my thing.
Welcome.
I have a bathroom story for you too.
Fantastic.
And it sort of comes along with that idea of the sex offender conversation and whether desegregating bathrooms would create more danger, which I disagree with. But in my daughter's elementary school, they built a new elementary school and they created single-use bathrooms. And after it had been open for a few months, there was a huge uproar among the parents because the parents were learning about the fact that there were boys and girls that were sharing the same bathroom stalls. And it was less about safety and more about boys peeing all over the floor and making a mess in the stalls. And so the solution, this is a story, it's not really a question, but I'm curious. the solution was not to talk to the boys about cleaning the bathroom.
Yeah.
It was to make sort of informal segregation and let the clean bathrooms go to the girls and the messy ones stay with the boys. And I just think that there's this social obligation that we have. And again, I'm not saying that all male people don't clean the bathroom, but there is sort of this social patriarchal sort of thing around like how are we socializing and teaching about keeping bathrooms clean and safe for everybody, period.
Yeah, I mean, again, the flood of stories I get from people, I am firmly convinced that both men and women, boys and girls, are disgusting, right? And so you can find avenues or examples in which, you know, little girls have just been gross to, right? But I do agree that there is this like patriarchal indoctrination about like, you know, boys being dirty and bad, and I just think that's a bunch of nonsense, right? Sex stereotypes help no one, so we should not be enforcing them.
I think we're good. I can be loud. Sorry. I want to thank everybody for coming. I certainly want to thank Rick for adding an extra day onto his trip and being able to share his work with us. I think it's really interesting, and now we will all be very grateful for the access to toilets that we have at the school of public health.
Yes, yeah. Thank you.